Interview with Senior Technical Advisor Mr. Bennett Asia at JPS Africa Podcast Studio at Brooklyn, Pretoria. Strategic importance of VMMC lies in its long-term impact on reducing HIV transmission and strengthening health systems. As a once-off intervention with lifelong partial protection, VMMC contributes significantly to lowering new HIV infections and improving community health outcomes. Mr. Asia, what is the strategic value of OSCEs in improving the quality of VMMC services?
Thank you for the opportunity to take part in this engagement. So the ultimate objective, and it is actually one of those non-negotiable types, is to provide a safe and high quality based VMMC service. And the OSCE can greatly assist in making sure that one assists clinicians in making sure that they move away from parrot fashion learning and memorizing procedures to having a more deeper understanding of what the procedure is all about. And secondly, it also assists with the assessment of a higher level of clinical reasoning during the process.
What is the long-term strategic value of integrating OSCEs into VMMC training?
The integration of using an OSCE in that regard is to make sure that we have clinicians who are practice ready. And when clinicians are practice ready, they are competent to provide that service. They have the right knowledge, the right skill, the right attitude in making sure that that mix of those three elements assist them in having the required level of competency. And because a medical male circumcision is purely based on your level of competence, there's no room for mistakes. That's why the OSCE, in its primary design and the way OSCE stations are set up, the use of checklists, the use of models, are then actually providing the opportunity to assess clinicians in the real life situation.
So you mentioned competent clinicians. How do you ensure a competent and practice-ready workforce?
Well, there are various ways and means of making sure that clinicians and other staff, may I add, are competent in what they are doing. And for that, we have a myriad of training opportunities, but also training modalities. Clinicians of different professions, those are medical doctors, clinical associates, and professional nurses who then are authorized to perform medical male circumcisions, are trained in these modalities using direct face-to-face learning on the basis of particular modules and particular exercises linked to enhancing learning. Secondly, having introduced microlearning, whereby clinicians can learn or get capacitated in their own time, and these are actually monitored closely to make sure that they are completing the various courses, and there's a record of that training. And above that, and more importantly, is to make sure that there's assessment of learning and to what degree the level of competence has been achieved. Then we have clinical mentors, clinical supervisors, who are going out to the various sites where clinicians are working, who are mainly the implementing partners through the JPSA hybrid model that they use. And these clinicians are then providing supportive supervision, do on-site assessments, and also making sure that if any particular issue has been picked up that needs attention in terms of not meeting the quality and clinical standards that have been set, these clinicians are then also receiving on-the-spot training in that regard.
So how do you improve quality and safety of VMMC services?
Well, it relates to some of these points I've already mentioned. And just to emphasize some of those, for example, making sure that the MMC service that is provided through JPSA meet the required training standards, and these standards are also based on the fact that South Africa as a country is part of the WHO family, and by implication following these guidelines issued by the World Health Organization, the National Department of Health then develops its own set of standards and guidelines for the provision of VMMC services. And as a result of that, JPSA then makes sure that it follows those guidelines and prescripts rigorously. The training material are also directly in line with those respective guidelines, therefore making sure that there are no shortcomings in terms of the content of the training, also how the training is happening, including the assessment of clinicians to make sure that they have the required level of competence, and the emphasis is on providing a safe and high quality service.
And how do you strengthen standardization and equity in training?
JPSA, through the engagement of the VMMC program and actually providing the VMMC program in particular, is making sure that all clinicians and other staff, for example, that they are part of the training toolkit that is being presented by JPSA. So whether it's a clinician, whether it's a data clerk, whether it is a facility manager, all of them invariably benefit from the training material and the programs and different courses which is being presented by JPSA, thereby making sure that there is access to everybody and for everybody in making sure that they benefit from the training interventions offered by JPSA.
Evidence shows that structured training, mentoring, and continuous quality improvement interventions improve VMMC service quality, for example, infection prevention and surgical performance outcomes. So, how does one enable safe scale-up of VMMC programs?
As I said, the provision of VMMC services through JPSA, but then again, the emphasis is on how do we use and implement and or apply the use of the OSCE, is then to make sure that the OSCE represents a real life situation whereby clinicians are then trained according to those prescripts, guidelines, and as I've indicated, the training material which have been lined up along those guidelines and prescripts. Secondly, it is also making sure that the OSCE is not just available as a training modality, but it's also used as an assessment tool. And it is that part of using it as an assessment tool that we get a real sense of the level of clinical competence of clinicians. Thereby, it can then actually be offered to other entities, other organizations who are in the VMMC space to make sure that they benefit from such an intervention.
And how does one enhance public trust?
The whole notion of client satisfaction in the VMMC program is critical in making sure that the client must at all times be satisfied, be happy about the procedure that has been offered. The VMMC program is also part of the global health goals, and as you've mentioned earlier on, that VMMC services also forms part of one of the primary strategies of HIV prevention and reduction of HIV incidence. So therefore, if you have a client who is happy, number one, and satisfied for that matter. Number two, if you have a program that performs at the required level of safety and quality. And number three, it promotes to the uptake of VMMC services in communities, then those are the kinds of indicators, if not criteria, that must be promoted at all times to make sure that we have growth in the VMMC program, and more importantly, that communities, the client who comes for the VMMC service, that the client can speak on the basis of having had a positive experience.
How does the use of an OSCE contribute to broader health system strengthening?
Health system strengthening is one of those activities that we must promote at all cost, because if a health system is weak, it cannot meet the objectives of providing safe, quality health service, not just in VMMC. However, using VMMC is such an instrument in making sure that if you can prove and show through proper client satisfaction surveys and experience, through proper data analysis, that through VMMC you can then strengthen the health system, then those are the kinds of things that one needs to promote at all cost. So I would just like to share a few key insights in summary. Number one, the purpose of the OSCE then in VMMC is to make sure that it assesses real clinical competence objectively and reliably. Secondly, the educational value enhances learning through simulation and feedback. Number three, the strategic value ensures quality, safety, and standardization in VMMC services. And lastly, the very point that you've raised, how does the OSCE, as a small contributor in the health system set of objectives, how does that support and strengthen our system? And that is through scale up, quality improvement, and workforce development.
The strategic impact of education and training using OSCE in VMMC is that it converts training into measurable clinical competence, ensures high quality and safe service delivery, enables effective program scale up, and strengthens both workforce capability and health system performance. Mr. Asia, thank you for your time today.
Thank you very much for this opportunity, and I trust that these interviews would be shared widely, because I think it does have the potential to assist others who are in the same field, making sure that they have the desired competence, as well as leading to better health outcomes for the client, and by implication, promoting a safe and high quality service. Thank you.
Thank you, sir.